Hi everyone, welcome to the Value. So today we're going to talk about Veru, and they just had their conference call today and a lot of positives from that. So we're going to go through that today, and firstly we're just going to go through the share price. It's at $7.27 with a market valuation of $581 million, which is shocking because they just released some really good news, yet the share price is down. So rather disappointing. I thought it would actually be up. So in honesty, kind of surprises me to actually see what I'm seeing today. Maybe it surprises you as well. But sometimes that's just reality, and they could have a lot of people shorting the stock, which makes it even tougher because like people short the stock falls, people panic, they sell, and yeah, like it just doesn't. It just makes people uncomfortable. So sometimes people prefer not to be in the stock. But for me, I choose to focus on the fundamentals. That's why I listen to the conference calls. That's why I always look at what's going to make this company a valuable company rather than, because the share price only tells you so much because it's just a price. It's more about the activity that goes on behind the scenes. And if you listen to the conference call, you'll actually feel pretty upbeat about things. CEO was pretty upbeat. He's like, FDA was really happy, basically gave them the green light to basically go put this application through with quite a bit of encouragement as well. So it sounds like FDA is more than happy with what they've presented, and that no further testing was required. So they're happy with the data, which is literally the most important part. If you're happy with the data, what else is there to really scrutinize? So then they're like, finalize all your data, put it into an application so we can kind of go through that and then basically put you through the process to getting approval. So again, but no approval was fully guaranteed until it's actually happening. So we still have to wait for the approval, of course, and that could be a time-consuming process too. But in terms of other things that they talked about the short reports, and they were saying that the standard of care was well balanced because there was some scrutiny around the standard of care. There was also scrutiny around whether that had any interruptions of Sibizalin between the standard of care and the drug. And they said there was a clear benefit of Sibizalin over the standard of care, so no problem there. If you don't know why the standard of care matters, because like sometimes if the patient receives a really good treatment of other drugs, then potentially that might interfere with the effects that Sibizalin had. But as I've said, overall it's a clear sign in terms of the data that Sibizalin had a clear benefit. There were kind of worries around the trial numbers being too small, but FDA has come out and said to them that the numbers are fine, that they don't have to do any more testing, so that kind of clears that issue. In terms of mortality rates, some people thought some of the countries that they did the trials in had higher mortality rates, which might affect the actual data. But in their data, there were actually quite high mortality rates, say like in the US as well. So then it actually balanced it out. So there was really no problem with the data. And the thing is, you got to remember with these short reports, they don't actually have the full details of this trial. So for them, they're just making a lot of assumptions, and the CEO does not agree with them. But for him, he doesn't really care about it because he's like, only the FDA really matters. These shorters, they don't really matter. But because it does affect the mindset of shareholders, so the CEO does feel some obligation to talk about it. So basically, they're also talking with the government agencies about advanced purchase agreements. So that's how confident they are that they're already in discussions. And they're also talking with other countries as well. So they're talking with the European Union. They're looking at basically getting this into Europe, talking with like Britain. They're also looking at South America, and also they're looking at South Africa as well. So the company's not resting on its laurels. It's going out there and basically making things happen. And also they talked about some of their manufacturing. They think initially they'll do about 50,000 doses, and they didn't specifically say around July, but I think, like the indication was it would probably be around July when things will get going. And then they did indicate by August they will have 100,000 doses that they can produce. And then by September, they said they can produce about 250,000 doses. So that kind of sort of gives you a timeline of their feeling of when they can start producing and selling. So it sounds like it's sort of around this July kind of time frame, which is not too far away considering we're in May. That's just another 2 more months. So some good things could be happening in the stock in the next 2 months. Though it also means there might be a quiet period, so you probably want to be the patient type. If not, you might not like the waiting. But if you give the patience, then some good things might be coming your way if assuming approval is done. I think that's my overall notes. They said in terms of the process, it's an active process, so it's done in real time, so they don't have to constantly compile the whole application with all the data all at once. They can actually give the FDA what they have right now, and then they can actually submit more data as they go along because some data is not finalized. So overall, things look to be going well. They said in terms of their manuscript that it is written and it's being reviewed, and they will put this out in a peer-reviewed journal, and that will probably be on an online format, and that apparently that might come out at a similar timing to the approval with their application. So that kind of gives you an idea of some things where they'll be at in terms of that. But like overall, it seems like it will be around July when things will really get moving for this company, which kind of gives you an opportunity to buy more if you really want to. That's if you have the confidence in this company. They did, I think, they did estimates in terms of hospitalization rates. They said their estimate number is around 1,950 every day. So for them, on a weekly basis, they would estimate over 7,000. On a monthly basis, they would estimate about 30,000 daily hospitalized patients. So, monthly hospitalized patients, about 30,000 for the month. Hence why they've got those certain amount of doses, and I think by September they should be able to supply the whole of the US, and then after that move on to the rest of the world. So overall, some good details in terms of how they will progress, and also their confidence in terms of getting this approval done, because at the end of the day, if the FDA is happy with the numbers, then there's really no scrutinizing them that much, because they've looked through the data. They even encouraged them to put this application through. But again, these things take time because they have to finish compiling the numbers, they have to put this application through, and then everything has to be formally done. So it all takes time because these are normal processes, and these things, like they just have to follow it by the book. Hopefully everything goes smoothly, and we will see a much higher share price than what we're seeing right today. Let me know if you've got any questions or comments. Until then, good luck investing, everyone.